Osteoporosis. Osteoporosis is a medical condition in which the bones become weak and fragile, making them more susceptible to fractures. It occurs when the body loses too much bone tissue, doesn't make enough new bone tissue, or both. As a result, bones become porous and fragile, and can easily break even with minor stress or injury. Osteoporosis can affect any bone in the body, but the most commonly affected bones are the spine, hip, and wrist. This condition is more common in women, particularly after menopause, although men can also develop osteoporosis. Osteoporosis can be diagnosed through a bone density test, which measures the amount of bone mineral in the bones. Most common osteoporotic fractures of wrists, vertebrae, hip, etc. Osteoporosis can cause a variety of fractures, but there are some types of fractures that are more common in people with osteoporosis. Here are some of the most common osteoporotic fractures. 1. Wrist fractures. Wrist fractures are the most common type of osteoporotic fractures. They typically occur in the radius, the bone in the forearm that connects to the wrist. These fractures are often the result of a fall onto an outstretched hand. 2. Spine fractures. Spine fractures, also known as vertebral compression fractures, are another common type of osteoporotic fracture. These fractures occur when the bones in the spine become weak and collapse, resulting in a loss of height and curvature of the spine. These fractures can cause severe pain and discomfort, and may lead to a hunched posture. 3. Hip fractures. Hip fractures are a serious complication of osteoporosis. They occur when the bones in the hip become weak and break, usually as a result of a fall or other injury. Hip fractures are particularly dangerous for older adults, as they can lead to a loss of mobility and independence. 4. Pelvic fractures. Pelvic fractures occur when the bones in the pelvis become weak and break. These fractures can cause severe pain and may require surgery to repair. 5. Shoulder fractures. Shoulder fractures are less common than other types of osteoporotic fractures, but they can still occur in people with osteoporosis. They often occur as a result of a fall onto the shoulder or an outstretched arm. In general, osteoporotic fractures are more likely to occur in older adults and in people with other risk factors for osteoporosis, such as low bone density or a family history of the condition. Treatment for osteoporotic fractures typically involves rest, pain management, and sometimes surgery to repair the broken bone. To prevent future fractures, it is important to manage osteoporosis with lifestyle changes and medications as recommended by a healthcare provider. Incidence of osteoporosis. The incidence of osteoporosis varies depending on various factors such as age, gender, genetics, and lifestyle factors. According to the International Osteoporosis Foundation, osteoporosis affects an estimated 200 million women worldwide, with approximately 1 in 3 women over the age of 50 experiencing osteoporotic fractures. Men are also affected by osteoporosis, although to a lesser extent. With an estimated 1 in 5 men over the age of 50 experiencing osteoporotic fractures. The incidence of osteoporosis tends to increase with age, as bone density naturally declines with aging. In summary, the incidence of osteoporosis is relatively high, particularly among women over the age of 50, and is influenced by a variety of factors such as age, gender, genetics, and lifestyle habits. Who gets osteoporosis? Osteoporosis can affect both men and women of any race or ethnicity, but it is more common in certain groups. Here are some of the factors that can increase a person's risk of developing osteoporosis. 1. Age. Osteoporosis is more common in older adults, particularly women who have gone through menopause. As people age, their bones become less dense and more brittle, which increases the risk of fractures. 2. Sex. Women are more likely than men to develop osteoporosis, especially after menopause, when their levels of estrogen decrease. Estrogen helps to protect bones, so the loss of estrogen during menopause can lead to bone loss. 3. Family history. If a person has a family history of osteoporosis or fractures, they may be at higher risk of developing the condition. 4. Low body weight or small body frame. People with a lower body weight or smaller body frame have less bone mass to begin with, which can make them more susceptible to osteoporosis. 5. Poor nutrition, a diet that is low in calcium and vitamin D can contribute to osteoporosis. 6. Sedentary lifestyle, lack of physical activity can lead to weak bones and increase the risk of osteoporosis. 7. Smoking and excessive alcohol consumption. Both smoking and excessive alcohol consumption can weaken bones and increase the risk of osteoporosis. 8. Certain medical conditions. Some medical conditions, such as hyperthyroidism and rheumatoid arthritis, can increase the risk of osteoporosis. It is important to note that many people who develop osteoporosis have more than one of these risk factors. What causes osteoporosis? Osteoporosis is caused by a combination of factors, including genetics, lifestyle, and hormonal changes. Here are some of the key factors that can contribute to the development of osteoporosis. 1. Aging. As people age, their bones naturally become less dense and more fragile, which can increase the risk of osteoporosis. 2. Hormonal changes. The loss of estrogen in women after menopause and the decline in testosterone in men can contribute to the development of osteoporosis. 3. Genetics. Family history of osteoporosis can increase the risk of developing the condition. 4. Poor nutrition. A diet that is low in calcium, vitamin D, and other important nutrients can contribute to osteoporosis. 5. Sedentary lifestyle. Lack of physical activity can lead to weak bones and increase the risk of osteoporosis. 6. Smoking and excessive alcohol consumption. Both smoking and excessive alcohol consumption can weaken bones and increase the risk of osteoporosis. 7. Medical conditions. Certain medical conditions, such as hyperthyroidism, hyperparathyroidism, inflammatory bowel disease, and rheumatoid arthritis, can contribute to the development of osteoporosis. 8. Certain medications. Some medications, such as glucocorticoids and some anticonvulsants, can increase the risk of osteoporosis. 9. Low bone density. A person with low bone density is at a higher risk of developing osteoporosis. 10. Fragility fractures. A person who has already experienced one or more fragility fractures is at an increased risk of developing osteoporosis. 11. Long-term immobility. Prolonged bed rest or immobility can lead to the loss of bone mass, which can contribute to osteoporosis. What are the symptoms of osteoporosis? Osteoporosis is often called a silent disease because it typically does not cause any symptoms in the early stages. As the disease progresses, however, a person may begin to experience the following symptoms. 1. Loss of height. Osteoporosis can cause compression fractures in the spine, which can lead to a loss of height over time. 2. Back pain. Compression fractures in the spine can also cause back pain, which can be mild or severe. 3. Fractures. Osteoporosis increases the risk of fractures, particularly in the hip, wrist, and spine. These fractures can occur with little or no trauma and may be accompanied by severe pain, swelling, and bruising. 4. Stooped posture. Compression fractures in the spine can cause the spine to curve forward, leading to a stooped or hunched posture. 5. Weakness. Osteoporosis can weaken the bones in the arms, legs, and spine, making it difficult to perform everyday activities such as lifting, bending, and walking. 6. Tooth loss. Osteoporosis can also affect the bones in the jaw, leading to tooth loss and other dental problems. 7. Shortness of breath. Smaller lung capacity due to compressed discs. It is important to note that many people with osteoporosis do not experience any symptoms until they suffer a fracture. For this reason, it is important for individuals who are at risk of osteoporosis to undergo regular screenings and take steps to prevent the disease from progressing. Our everyday habits, good and bad, affect bone health. How do our habits stack up? Our everyday habits play a significant role in bone health. Here are some habits that can have a positive or negative impact on bone health. Good habits for bone health. 1. Consuming a diet rich in calcium and vitamin D. Calcium and vitamin D are essential nutrients for bone health. Consuming foods that are rich in calcium and vitamin D, such as dairy products, leafy green vegetables, and fatty fish, can help to strengthen bones. 2. Engaging in weight-bearing exercise. Weight-bearing exercise, such as walking, jogging, and weightlifting, can help to strengthen bones and prevent bone loss. 3. Getting enough vitamin K. Vitamin K helps to regulate calcium in the body and can be found in leafy green vegetables, such as kale and spinach. 4. Limiting alcohol consumption. Excessive alcohol consumption can weaken bones and increase the risk of fractures. 5. Not smoking. Smoking can interfere with the body's ability to absorb calcium and can increase the risk of fractures. Bad habits for bone health. 1. Consuming a diet high in sodium. A diet high in sodium can cause the body to lose calcium and increase the risk of bone loss. 2. Sedentary lifestyle. A lack of physical activity can lead to weak bones and increase the risk of osteoporosis. 3. Excessive caffeine consumption. Consuming too much caffeine can interfere with the body's ability to absorb calcium. 4. Smoking. Smoking can interfere with the body's ability to absorb calcium and can increase the risk of fractures. 5. Excessive alcohol consumption. Excessive alcohol consumption can weaken bones and increase the risk of fractures. It is important to note that good habits for bone health should be practiced consistently over time to have a positive impact on bone health. Additionally, these habits should be combined with regular bone density screenings. And medical treatment is necessary to prevent or manage osteoporosis. How is osteoporosis diagnosed? Osteoporosis is diagnosed through a combination of medical history, physical examination, and diagnostic tests. Here are some common methods used to diagnose osteoporosis. 1. Dual Energy X-ray Absorptiometry, DXA. DXA is the gold standard for measuring bone mineral density, BMD. It is a non-invasive, painless test that uses low-dose X-rays to measure BMD in the spine, hip, or wrist. The results are reported as a D-score, which compares a person's BMD to that of a healthy young adult. 2. Vertebral Fracture Assessment, VFA. VFA is a type of DXA that uses X-rays to detect vertebral fractures in the spine. It is often done in conjunction with a DXA scan to provide a more complete assessment of bone health. 3. Laboratory tests. Blood and urine tests can be used to measure levels of calcium, vitamin D, and other nutrients that are important for bone health. These tests can also help to rule out other medical conditions that may be contributing to bone loss. 4. Medical history and physical examination. Your healthcare provider will ask about your medical history and perform a physical examination to check for signs of osteoporosis, such as loss of height, a stooped posture, and fractures. '5. FRAX score. FRAX, Fracture Risk Assessment Tool, is a computer-based tool that calculates a person's 10-year probability of experiencing a hip fracture or other major fracture. It takes into account factors such as age, sex, weight, and medical history. It is important to note that osteoporosis can be diagnosed before a fracture occurs, which is why screening is recommended for women over the age of 65 and men over the age of 70, or earlier if there are risk factors present. How is osteoporosis treated? The treatment of osteoporosis is aimed at preventing further bone loss, reducing the risk of fractures, and promoting bone growth. The treatment plan for osteoporosis may include the following. 1. Lifestyle modifications. Lifestyle modifications such as regular weight-bearing exercise, adequate intake of calcium and vitamin D, quitting smoking, limiting alcohol intake, and avoiding falls can help to improve bone health and reduce the risk of fractures. 2. Medications. There are several medications available for the treatment of osteoporosis. These medications work by either slowing down bone loss or increasing bone formation. Examples of medications include bisphosphonates, hormone therapy, selective estrogen receptor modulators, calcitonin, and denosumab. 3. Fall prevention. Falls are a common cause of fractures in people with osteoporosis. Fall prevention strategies such as modifying the home environment, using assistive devices, and participating in balance training programs can help to reduce the risk of falls and fractures. 4. Surgery. In severe cases of osteoporosis, surgery may be necessary to repair or replace bones that have fractured. Procedures such as vertebroplasty and kyphoplasty can be used to treat vertebral fractures, while joint replacement surgery may be needed for hip or knee fractures. It is important to note that the treatment plan for osteoporosis will vary depending on the individual's age, sex, overall health, and severity of the condition. Regular monitoring and follow-up with a healthcare provider are important to ensure that the treatment plan is effective and to make any necessary adjustments. What medications are used to treat osteoporosis? There are several medications available to treat osteoporosis, and they work by either slowing down bone loss or increasing bone formation. The choice of medication will depend on the individual's age, sex, overall health, and severity of the condition. Here are some common medications used to treat osteoporosis. 1. Bisphosphonates. These medications, such as alendronate, ibondronate, and zoledronic acid, slow down bone loss by inhibiting the activity of cells that break down bone. They are taken orally or by injection. 2. Hormone therapy. Estrogen therapy or combination estrogen and progestin therapy can help to slow down bone loss and increase bone density in women who have gone through menopause. However, hormone therapy is associated with some risks, such as an increased risk of breast cancer, stroke, and blood clots. 3. Selective estrogen receptor modulators, SERMs, such as raloxifene, act like estrogen in some parts of the body, but not in others. They help to reduce the risk of fractures by increasing bone density. 4. Calcitonin. Calcitonin is a hormone that helps to regulate calcium levels in the body. It can be taken as a nasal spray or injection and helps to reduce bone loss. 5. Denosumab. This medication is an antibody that targets a protein that is involved in bone loss. It is given as an injection and helps to reduce the risk of fractures. 6. Teriparatide. This medication is a synthetic form of parathyroid hormone and helps to stimulate bone formation. It is given as a daily injection and is usually reserved for people with severe osteoporosis. 7. Romosozumab is a newer medication for the treatment of osteoporosis that was approved by the U.S. Food and Drug Administration (FDA) in 2019. It is a monoclonal antibody that works by inhibiting a protein called sclerostin, which helps to increase bone formation and decrease bone resorption. Romosozumab is given as a subcutaneous injection once a month for a period of 12 months. Clinical trials have shown that it can increase bone density and reduce the risk of fractures, including vertebral and hip fractures. However, there are some potential risks associated with romosozumab, including an increased risk of heart attack, stroke, and cardiovascular events. Therefore, the FDA recommends that it be used in individuals who have a high risk of fracture and have exhausted other treatment options or are intolerant to other treatments. As with any medication, it is important to discuss the risks and benefits with a healthcare provider before starting treatment with romosozumab. It is important to note that all medications have potential side effects and risks, so it is important to discuss the risks and benefits with a healthcare provider before starting any medication. When should osteoporosis be treated with medication? The decision to treat osteoporosis with medication depends on several factors, including the individual's age, sex, bone density, history of fractures, and overall health. In general, medication is recommended for people who are at high risk of fractures, such as those who have a history of hip or vertebral fractures, a T-score of -2.5 or lower on a bone density test, a T-score between -1.0 and -2.5 on a bone density test, and additional risk factors, such as a history of fragility fractures, low body weight, or use of certain medications that increase the risk of fractures. An elevated risk of fractures based on a fracture risk assessment tool, such as the FRAX tool. Medication. In addition, medication may be recommended for people who have rapid bone loss or are unable to tolerate lifestyle modifications or other non-medication treatments. It is important to note that the decision to treat osteoporosis with medication should be made in consultation with a healthcare provider, who can evaluate the individual's risk factors, discuss the potential benefits and risks of treatment, and determine the most appropriate treatment plan. How about the usage of supplements in the treatment of osteoporosis? Supplements can be used as an adjunct to medication and lifestyle changes in the treatment of osteoporosis. Here are some supplements that are commonly used. 1. Calcium. Calcium is an important mineral for building and maintaining bone density. The recommended daily intake of calcium for adults is 1,000 to 1,200 milligrams. Calcium can be obtained from food sources such as dairy products, leafy greens, and fortified foods, or from supplements. It is important to note that calcium supplements should be taken with food to aid in absorption, and should not be taken in excess, as excessive calcium intake can lead to kidney stones and other complications. 2. Vitamin D. Vitamin D is necessary for the absorption of calcium and for maintaining bone health. The recommended daily intake of vitamin D for adults is 600 to 800 IU. Vitamin D can be obtained from exposure to sunlight, food sources such as fatty fish and fortified foods, or from supplements. 3. Magnesium. Magnesium is a mineral that is important for bone health, as it helps to regulate calcium levels in the body. The recommended daily intake of magnesium for adults is 320 to 420 milligrams. Magnesium can be obtained from food sources such as leafy greens, nuts, and whole grains, or from supplements. 4. Vitamin K. Vitamin K is necessary for the activation of proteins involved in bone formation. The recommended daily intake of vitamin K for adults is 90 to 120 micrograms. Vitamin K can be obtained from food sources such as leafy greens, broccoli, and soybeans, or from supplements. It is important to note that supplements should not be used as a substitute for medication, and should be used under the guidance of a healthcare provider. In addition, some supplements can interact with medications and other supplements, so it is important to discuss their use with a healthcare provider before starting them. How can you prevent osteoporosis? There are several lifestyle modifications that can help to prevent or slow the progression of osteoporosis. 1. Get enough calcium and vitamin D. Adequate intake of calcium and vitamin D is important for maintaining bone health. The recommended daily intake of calcium for adults is 1,000 to 1,200 milligrams. And the recommended daily intake of vitamin D is 600 to 800 IU. Calcium. Calcium can be obtained from food sources such as dairy products, leafy greens, and fortified foods, or from supplements. Vitamin D can be obtained from exposure to sunlight, food sources such as fatty fish and fortified foods, or from supplements. 2. Exercise regularly. Weight-bearing exercises such as walking, jogging, and weightlifting can help to strengthen bones and reduce the risk of fractures. 3. Avoid smoking and excessive alcohol consumption. Smoking and excessive alcohol consumption can increase the risk of osteoporosis and fractures. 4. Maintain a healthy weight. Being underweight can increase the risk of osteoporosis and fractures. Maintaining a healthy weight can help to reduce this risk. 5. Prevent falls. Falls are a major cause of fractures in older adults. To prevent falls, it is important to remove tripping hazards, use handrails on stairs, wear shoes with non-slip soles, and use assistive devices such as canes or walkers if needed. Discuss bone health with a healthcare provider. A healthcare provider can assess an individual's risk of osteoporosis and recommend appropriate lifestyle modifications or medications if necessary. It is important to note that these lifestyle modifications are most effective when started early in life and continued throughout adulthood. The prognosis for osteoporosis varies depending on various factors such as the severity of the condition, the age, and overall health of the patient, and the effectiveness of treatment. Without treatment, osteoporosis can lead to an increased risk of fractures, which can be associated with significant pain, disability, and loss of independence. Hip fractures, in particular, can be life-threatening, with up to 20% of patients dying within 1 year of the fracture. However, with proper treatment and management, the prognosis for osteoporosis can be improved. By following a comprehensive treatment plan, patients with osteoporosis can often slow or even reverse bone loss, reduce the risk of fractures, and improve overall quality of life. It is important for patients with osteoporosis to work closely with their healthcare providers to develop an individualized treatment plan that takes into account their unique medical history, lifestyle factors, and preferences.